95-year-old Bob Arbach has been playing the piano since he was 5 years old.
I like the music, I like doing it. It's fun.
Bob is at the piano every day, but recently his play was interrupted when he was hospitalized with breathing problems. After 3 days at University Hospital, UW Health offered Bob home-based hospital care. He'd get the same care he received in the hospital, but in the comfort of his home.
I said, that sounds perfect. I mean, it is. I slept at home, made my own coffee, played the piano, and did the things that I would normally do.
Hi. Dr. Shapiro here.
A team of caregivers came to see Bob. He saw a doctor, nurse, physical therapist, and occupational therapist in the comfort of his home.
We do the basics, give them the antibiotics, check their vital signs, check the labs, just like we would be doing in the hospital. But people's bodies get better faster. They rest better, they eat better, they move more. And from what I've seen from years of the hospital compared to this, similar conditions being treated in the home do better.
How was your night last night?
They're home with their families, with their pets, in their own comfort. So many patients also are just like, oh, I gotta sit in my recliner, or, I gotta lay in my own bed. I slept so much better in my own bed.
Bob's daughter Emily was with him during most of the visits from the UW Health team.
It was great to be able to ask a nurse or a doctor for clarification. What do we do if? How does that work? And to be able to find out what the directions were, what the advice was. And it was also nice to know that if something went wrong, we could go right to the hospital, again, not through the ER.
I think it's great. I mean, it's the way it should be. The doctors used to make house visits, and there was something about knowing your doctor and the doctor not feeling rushed.
Patient experience has been basically 100% satisfied across the board. We track it very closely because we want to make sure that we're measuring the things we think we're seeing, but also paying really close attention to what caregivers are experiencing and families are experiencing, and it's been very, very positive.